We might have all read that AI can detect skin cancer much better than doctors can. But during my last visit to my dermatologist, I had a regular examination. She was still using the magnifier glass. And actually, I was hoping for her to use some AI-assisted detection method, maybe even wearing those Apple Vision Pros, kind of examining me. And everything is fine, and the examination went fine. But actually, I asked myself, what does it take and how long will it take for us to see AI in every doctor's office? And I could not think of anyone better to talk to about this topic with our first and next guest. He is the Global Chief Marketing Officer of GE Healthcare, of the Enterprise Imaging and Artificial Intelligence portfolio. He's also a professor of digital healthcare management at IE Business School and University College London, the European Corporate Chair of IHA MMS, and mentor to digital health, health tech, and artificial intelligence. Please welcome on stage Simon Rost. Hello, Simon.
Hey, nice to meet you guys.
Great to have you on the show. Simon, I have an initial question for you. In which year will we see Apple Vision Pros or any other AR, VR instrument in every doctor's office at my dermatologist?
I mean, I would basically say if I would be a dermatologist today, I would not wait for this newer, innovative, expensive technologies. I would double down on these things here, like on smartphones, for example, because we have a big access issue in healthcare. And by today, actually, you can do the screening that you defined by a magnifying glass with your cell phone from home, right? So I would double down on these kind of technologies first before I look into newer stuff like VR and AR. But look, my objective for today is to tell you guys why healthcare needs artificial intelligence. I brought also 3 real-time examples how algorithms are making a difference today already in the healthcare space. And I want to share my, let's say, 2 cents, what's needed to do exactly what you said, Markus, to bring these new technologies into the day-to-day practice, into the workflow of healthcare professionals. Let me quickly share my screen and start my presentation here. Give me a second, and you should see by now basically my presentation. Look, what I want to do is I want to give you quickly an overview why artificial intelligence is important for all of us, because we all will be patients. And here are some real, let's say, threatening facts. To be a patient today is not easy. We have more than 3.8 billion people who lack access to basic healthcare services. So think about it. It's roughly half of the planet's population missing this access to healthcare. If you talk to patients in the more developed world, roughly a third says, hey, I would like to have a virtual, basically, appointment. I don't like to go to the doctor physically. I could imagine doing things via smartphone and via a computer. But we also see that the infrastructure in healthcare is not there. We are a laggard when it comes to new technologies. Then, if you are on my side of the planet and you live in Germany, you spend each year on average as a patient 7.5 hours in a waiting room. And this doesn't include the commute and the time you need to get to the doctor. And the doctor, on average, just spends 7 minutes with you. And mainly, they spend time in an IT system not talking to you because they capture a lot of information. We have more than 42 million medical errors basically out there around the globe. It's the 3rd reason of death in the healthcare sector. I think about that. That's a tough statistic. And since COVID basically pushed out operations, we have a backlog of 30 million operations worldwide because in times of COVID, the doctors and the healthcare professionals focused on treating and saving life and not on longer-term diseases, which still happen, right? You don't get less heart attacks, you don't get less cancer because of COVID, right? So being a patient is a tough situation to be in. And by statistics, all of us will be patients. The other big problem we have is that our healthcare professionals are mainly overloaded by work. Here are some statistics that should show that as well. So look, 10 million shortfall by 2030. Think about that. So we have less people and more people getting ill. Then 72% today say they have got physical or mental strains in their work. 42% of clinicians, that's a real tough fact, they consider leaving their profession. I mean, think about this. People normally sign up for healthcare due to a purpose, and they spend quite some time in their education to get healthcare professionals. And now roughly 40% are saying, hey, I don't want to end up in this profession. Clinicians basically work with technology, but half of them, in the study that we did at GE Healthcare, say that, hey, it's actually not making my life easier. Technology, it's supposed to make my life easier, but it makes it more complex. I have to learn new tools, new methods, and so forth. And 47% at the end find that medical technology is not intuitive to use. So if you think about this, it's a big, big, big play also for you as entrepreneurs to make the life of healthcare professionals easier. If you now look into certain kind of facts that should give us basically tailwind to address all of these challenges, it's the explosion of data. I mean, 1/3 of the world's data is set to be produced in the healthcare space. If you would see, the average hospital produces 50 petabytes each year of medical information. Could be lab results, could be imaging results, could be results from the EMR, and so forth. If you would capture this knowledge in books, the most undigital thing out there, you would need 8 billion books to capture the average amount of healthcare information a hospital around everywhere in the globe basically produces. So if you search for the one sentence as healthcare professional that cures your patient in 8 billion books, I would say it's impossible. But exactly there, artificial intelligence is doing a great job. But here comes the crime. If you look into that, out of this 50 petabytes, 79%, 97%, sorry, is not used today. We roughly need to use 3% to help to diagnose and so forth. If you take an algorithm today, they take into account 30 data points, more or less. In the future, we could take this by a lot of more data points out there because the information is growing and it's also getting more different, right? More diversified. To give you a real example, a radiologist looked 15 years ago in a normal shift of 12 hours in the US at roughly 500 images. Today's, they are looking at 50,000 images. I mean, just the capacity to digest this information needs to be trained. And algorithm, Markus mentioned this in the beginning, likely do a better job because they don't get tired. If they have energy and data, they do a quite accurate job. And basically, they don't have shifts and so forth. If you now look into what happens to information as well, it gets more diversified. I talked about the 50 petabytes. That's what you see on top here in this chart in the light pink color, right? That's what a hospital at point of care data is produced. But all of us today, or many, we're like trackers. There is genetic information. There is socioeconomic data that could enrich basically healthcare professionals' work. And if you think about this, what the impact of these data points are today, the information that we produce in a hospital roughly only impact health outcomes by 10%. If we would be able to include lifestyle and behavioral data, human biology data, and social economic and environmental data, we would be able to predict diseases before they happen. So we could have a way bigger impact on health outcomes. And that's where artificial intelligence can make a difference. In our company, we believe that you have to bring 3 things together if you work in the healthcare space, or if you are a successful healthcare organization. One is what we call the disease state. So the medical knowledge, your core business, right? You have to basically come to a thing that we call precision medicine, to have the right diagnosis for the person at the time they need it, not for cohorts, right? The second thing is technology, right? That we call this smart devices. And the third one is digital. So if you are able to bring together clinical medicine, data science, and technology as a whole healthcare professional, you will succeed in the future. And here are 3 examples where we are actually doing this as we speak. 2 basically have the idea to carve out time for healthcare professionals and enhance what they are doing, enhance their capabilities. 1 is more on the efficiency pillar. Let me start with the first one. Here you see one of our intelligent machines. It's an X-ray machine that you use normally when you have any kind of trauma or when you basically go through the ICU. What you see here, it has an algorithm embedded that we call the critical care suite. So what does this algorithm do? You see this here. That's a normal environment a radiologist looks at. On the left, you see a scan basically of your chest. Right? A patient comes to the hospital, has breathing issues. The first thing that they do to rule out things is they do a chest X-ray. On the left, if you are a trained radiologist, you would see that here is a condition that's basically a collapsed lung, a pneumothorax, right? But if you basically are in a department like the ICU, the intensive care unit, or in a trauma center, you have a lot of things going on. Maybe you could oversee that. So what this algorithm does is 3 things. First, it addresses the quality issue. It tells you, hey, you have a chest X-ray here. So it's telling you basically what you see. Secondly, as you can see here, it says that there's a finding. The algorithm found, based on the thousands of data points and images that have been trained on, that you have a collapsed lung, and it highlights it for you, that you can see that as a healthcare professional. On top of that, it tells you the likelihood of this condition, the pneumothorax, is in an interval of 96%. So by that, it augments basically the capacity of the healthcare professional, right? Because you get a confirmation and you have a second pair of eyes looking at what you are doing and basically giving you the confidence in your decision. So here you can see the first point where actually an algorithm is enhancing the capability of a radiologist. And if I told you, if you see 50,000 images a day, this could help because yes, we as humans get tired, and yes, we basically need this kind of support. Secondly, you see here one of our wearable devices. This is an ultrasound scan. I talked about 3.8 billion people who don't have access to care. This device will change that, right? Because it's portable, it fits into your pocket, and you suddenly can do scanning virtually everywhere where you are, right? With a smartphone or an iPad and basically this probe, how we call it, you are able to capture information. But the people who went to ultrasounds know that the result very much depends on who is scanning, right? And the skill set and the training that these people received. So there's a second algorithm from the company Caption Health that basically helps you in guiding how this ultrasound exam is done. And it first shows you step by step how you should do it in real time. It tells you where you should scan and how you should scan. It tells you the quality of your scan, and it basically also interprets some of the results directly and captures automatically, let's say, diagnosis that you need. For example, in this case, the ejection fraction, basically a result that you see how good your heart is pumping. So what you see here is people like you and me suddenly can do ultrasound scans like trained individuals. Why is that important? First of all, think about a more rural environment. Think about the third world where you don't have trained people everywhere and where sometimes you have to travel for a certain kind of amount to do exams. This could overcome this kind of access problem, right? Because you can do the exam somewhere. Even untrained people with using this kind of technology can get to a result that then can be shared with a professional saying, hey, you have to come in and you have to take this journey or not. This is used, for example, in maternal care, in the cardiology space and so forth. And in the developed world, this helps for people who are basically still in training to get similar results. It clearly has 2 main advantages. One is quality, the second one is access. The third example I have is more around efficiency and basically around how you are using artificial intelligence to improve your operations. What you see here is likely the worst that could happen to a healthcare department, an empty chair. Why is that? Because you slotted basically a patient and he or she just didn't show up, right? That's a big, we call this no-shows in our world. That's basically a big burden to the healthcare system. Before COVID, I talked about a backlog of 30 million operations that are waiting basically to get done. Before COVID, just in England, basically 8 million appointments were missed, basically in 2018. This means a cost of £1 billion to the NHS, which is the equivalent to 250,000 hip replacements or less than 1 million cataract operations. Think about this missed potential, right? And in a sector which is basically at the limits, it's bad that this happens. So what we have is basically an algorithm that can help you to predict so-called no-shows, right? It takes into account 30 plus variables, like patient information, like environmental information, like weather, traffic information, for example, appointment-specific data, and it tells you what the no-show probability is based on your historic trends, and it basically enables the hospital to do counter activities, right, and to send out reminders or to basically call you that you have a meeting. I give you a very pragmatic example from Germany. If Simon Rost, for example, goes to the Oktoberfest in September and October and has an appointment at 8:30 in the morning, likely, if he went to the corporate reason, how we call it, it's not that likely that he will show up early on. So don't even show him this kind of meeting. Give him a meeting more around noon. And this is specific, could depend in case of weather, sometimes for the elderly population or traffic and so on. You can predict who's coming or who's coming late to then adapt your schedule accordingly. So these have been 3 tangible example where artificial intelligence is making a difference. But I also told you, hey, we are a laggard when it comes to the implementation of these tools compared to other sectors. Here are the top 5 barriers that we normally hear when we talk to customers. The first one is, I said this in the beginning, we work in IT silos. 97% of the data that's a crime, I believe, is not used, and it's somewhere in a silo system. So to create this interoperability is likely the number 1 barrier we have today in our sector. Secondly, look, we have to find a way to implement these technologies into the way of working of healthcare professionals, in best case that they don't have to change the way how they work, because they work in a very, very secure and very important environment where if you change something, this is not a good thing. So you have to basically integrate this seamlessly in their way of working and to their user experience. Then we are highly regulated for good reasons, because we treat with human lives and data regarding that. But this holds us back sometimes to implement these kind of algorithms. Then there's a general, let's say, trust gap. I mentioned this in the beginning. And very importantly, we have an undefined exchange model of value. Right now, you are not even paid as a professional if you use healthcare AI algorithms in your way of working. And if we don't define this value exchange, we will not, if you don't get reimbursed for using it, it could become a hurdle. Here's basically to close my ideas what I think needs to happen, that we integrate this technology into the way of working of healthcare professionals. The first one, I would say, you have to first get the basics right. We talked about interoperability. We talked about these things before. So first, basically, get your process digitized before you go into the AI game, right? So take this digitization as a core benchmark, basically, where you are at this point in time before you think about AI, because it's a prerequisite to implement algorithms in your work. Second one is what I call key enablers. It has to be an approach where leadership is bought in. You need an enterprise-wide approach about your initiatives. You need a sophisticated data strategy. As I said before, we just need to use today 3% of these data points. And you need also the talents that sometimes want to work in other sectors, like for the Amazons of so forth, for the Microsofts and so forth, and not in healthcare. Now, there are the more human-specific factors. The first one is you have to involve all specialties from the beginning on in the hospital when you are defining and building these AI algorithms. You have to basically look into standard operations. You have to double down on user experience. I said one of the main criteria is the seamless integration into your workflow. And you basically have to use applications that make it easier for you to do your job, like the Caption Health algorithm I explained. And then last but not least, you have to double down on all of the change initiatives, which are in healthcare slightly different. We are a very clinical sector, and at the end, we have to prove that things that we work from the beginning on. This is done by peer-reviewed papers in our sector. So you have to double down on these initiatives. You have to develop proof points that artificial intelligence is helping you to get clinically better, right? And you have to communicate this transparently in both things, the positive but also the negative parts of it. I think in general, artificial intelligence needs a more positive storytelling in our sector. And then, as I said, you have to double down on these outcome proofs that you can show that they are either clinical, operational, or financial outputs in the operations of the healthcare systems. So with that, look, happy to answer any kind of question you might have. And yeah, floor is yours.
Simon, thank you so much. That was super interesting. And in fact, something that really got me staggering was that the good old data problem still exists. I started building data warehouses, I don't know, probably 12, 13, 14, 15 years ago. It was the same problem. The data is in silos. What can we do? And apparently it's across all kinds of verticals, healthcare, CRM, marketing, whatever it's going to be. What can we do that we can get data into one concise pool? What are the key success factors for doing this?
I mean, one important point, I think, when we talk about interoperability is the definition of standards, right? In the radiology space, we have this with a standard called DICOM. So it's the same standard how you communicate data points, but we need this across the healthcare sector, right? And data standard that's coming up right now with a lot of, let's say, prominence is FHIR. So that's the first thing that I think is crucial, that we define the standards of how data is exchanged, right? And then the second thing is doubling down basically on this vendor neutrality, right? Yes. We are a company that also we have shares and we want to make money, but still you have to develop this with open source ideas, right? And with an open source mindset. I always call the infrastructure of some hospitals like they're like a Frankenstein. You just build on an existing infrastructure. So these applications need to be vendor neutral and need to talk to each other. That's more or less what I think are the two main things that we should double down on. One is basically define the right standards. Secondly, basically have an open source mindset and a vendor neutral approach to that.
Yeah, thanks so much. I see so many similarities really between the fields that we all need to work on to create common standards, interoperability, all these things that IT systems need. But you mentioned that doctors are now looking at 15,000 images a day. Is that right? Did you mention that? 15,000?
15,000 in average shift, basically. You have got this slices of images, and it could become up to 50,000 images in a normal shift of 12 hours, yes, in the US.
So no wonder that people are actually dropping out and don't want to be in healthcare anymore, right, with all these long hours. So here's a question I actually have for you. With all this innovation coming and all these robots and assistants coming, do we actually still have nurses and doctors in 20 years from now?
I mean, look, I always think healthcare needs both artificial intelligence and also the human touch. I think Geoffrey Hinton in 2016 said that we should stop training radiologists because artificial intelligence will do a better job. Reality is that today we have a shortage in this profession. I personally believe that it will be always a hybrid approach or a symbiosis between both artificial intelligence, technology, and human capabilities. What I have to say, though, is that the content and how you will work likely will change. Look, it's like in other sectors as well. The healthcare professional who knows how to leverage technologies like artificial intelligence likely will outperform the one who's not using it. Right? That's a normal thing. Yeah. So that's what I think is the right mix for the future. So yes, I think there will be nurses. Yes, I think there will be doctors. But the way how you work will change, and you will see more technology in their workflow.
Thank you so much. Yeah, it actually resonates a lot with what I heard on a podcast, Diary of a CEO, where a very famous professor in AI said it's not about being the function anymore, but giving context, and I kind of interpret that the same way. We need AI and the doctors to really get their optimum results, right?
2 point. Yeah, 2 point. And look, guys, I selfishly also use this for call out. Our sector, as I said, is a quite conservative sector. We need the input from startups and new ideas, basically also to change the way how we provide healthcare. So you guys basically also working in other industries likely have ideas and have technologies that could augment what we are doing. I'm happy to take this conversation further if anybody's interested afterwards.
Yes. I think we have a question from the audience, right, Robert?
I do. Well, I personally do have a question on AI. AI and healthcare is, one of my, I wouldn't say hobbies, but I'm particularly interested in this. And the question that is always being asked to me is, who owns the patient and what is the role of AI? Who is responsible ultimately for the diagnosis of an AI system?
Yeah.
That can be, particularly in the US, that can be an issue in terms of responsibility, also in Europe. But who owns the client, who owns the patient, and who is responsible?
I mean, look, if you, my answer would be it's twofold. One is, as a patient, yourself should get very much involved into your care journey, right? And that's happening more and more. There are many apps that help you basically to do that as well. So you should have a vested interest as a patient first, that technology is part of the diagnosis, right? I truly believe that patients are going to ask in some years if artificial intelligence is part of their diagnosis, for example, right? A human eye and basically a quality check with AI is what I would basically prefer today already, right? But you asked who owns the final decision. I still believe that the liability lies with the hospital and the healthcare professional, right? That's why you will see this kind of double approach where you have a human being at the end signing off of the final decision, but artificial intelligence supporting it. That's what I think is the right approach today.
So it's a co-pilot and it's empowering patients to at least have a healthier life. Yeah, I have a question on health inequity, but I think it's such an important research area that maybe we can set up a more in-depth webinar on how to use AI in health in the coming weeks.
Happy to.
So that's my open invitation to you.